me here. Oh, it says we're live.
Live
and in person. Live from Southern California. We bring you Total Health Live with Monika Klein, nutritionist to the stars, and Dr. Christopher Vogelmann. That's my narration voice.
Oh.
My narration voice is one of choice when I do this once in a while. When the time is 1:15, unfortunately 15 minutes late, and the temperature is a lovely 56 degrees with mild showers.
No showers here, but yes, that
it's raining.
Low timber that you have.
It is raining here. Yeah, that's the one I want to do. I did take voiceovers at one point, voiceover lessons, but they want way back in the day, they wanted $2,500 to do a demo tape. That was in the 90s. And I thought, I'm not paying $2,500 for a little tape of me narrating Mercedes or your new realtor.
What you have to do is just do it. I mean, I've had a lot of years in TV and you just do it. But of course, if you want to be a voiceover artist, you need to.
I want to paint with my voice.
Have an agent and be,
dulcet tones.
So how's everybody's health today? How's everybody feeling today? It's Friday, although it could be any other day of the week.
It's Friday. Friday.
And we are,
I'm staying hydrated.
Yeah, I mean, I think this is all we can talk about is hydration, because what else do we say? We know, I just sent one of my husband's aides to Sprouts, which is similar to Whole Foods here in Southern California.
We know Sprouts.
Some probiotics.
Yeah.
So, you know, it's really quite amazing. As you all know, I have not been out of the house since March 17th due to protecting my husband specifically, but it's amazing. People calling, oh, well, I'm going to the store. Oh, there are volunteers available, or this. And by the way, I did read something on my local patch. I don't know if everyone gets patch anymore.
There are a lot of patches. They existed in Alexandria, Virginia, and Maryland, and other things. The patch. Yeah.
Right. So I think it was, I don't know what it was connected to, Yahoo, or I don't know. But anyway, I saw an article about this County of LA department now, where you call this number and they will deliver free of charge to seniors in the LA County area. So it's sort of a critical delivery service, something like that. I wish I had the number here, but I would hope that many of the counties around the nation are doing the same thing. Mm-hmm. Hopefully. Yeah. So I think that's a great service. And there's lots of services. Well, they're cropping up every day. I keep seeing one thing or another. The hospice of the Conejo Valley called us, and they don't only deal with hospice, they do deal with critically ill people. And so they called and asked if we needed anything to be picked up at any of the stores around locally. So that is really wonderful. It sounds good. Yeah.
We just picked up masks today in Coronado. Somebody, I apologize for not remembering the person. There is a local restaurant had some workers, I believe, and they were making masks. And he needed $5,000 for materials because he needed to make enough masks for 26,000 people here in Coronado. And so he took up donations, and instead of getting the $5,000 he needed, they wound up collecting $7,000, and it was only available to residents of Coronado. So you had to show your ID to make sure that you were actually a resident, and they just gave you bags of masks as you drove by. And it was very well organized, by the way, too. People directing traffic and doing all those things.
That's great.
Yeah, that's pretty.
Another resource is nextdoor.com, which is a sort of a local Facebook. And I see someone in the neighborhood posting all the time, and she's actually selling cloth masks right across the street. So I think she was charging like $3 a mask or something that, which is just, just wonderful.
Yeah.
To be able to have that, that kind of resource. Again, I think we're looking for resources, unusual, unique, and readily accessible resources everywhere.
I'm sorry, I'm just sharing to a couple of places here, so I am listening to you.
Well, it's okay. I am just talking about, because all of this impacts your health.
Yeah.
It can reduce your anxiety, knowing that there are resources available, knowing that we're all working together to get through this, really. So it's going to impact your health. And of course, the fallout of all of this, 3 months to 6 months down the line, the financial impact will, of course, impact people's health as well. So we're going to try to bring you ways to cope in the best way possible through the weeks and months ahead. Right, Christopher?
I do agree. Cope with hope. Keep hope alive. Keep cope alive. Coping is better than hoping.
I agree. Well, coping is better than hoping. I think they're both pretty equal in what we need right now. They're both pretty equal. So we're having, so Easter, Passover has started. Easter is coming on Sunday. I think of, is a time of resurrection. I hope we can resurrect ourselves and
it's not a societal. Yeah. Don't let your health get crucified. Yeah.
So, I mean, it's hard. I just talked to one of my husband's doctors about, the testing. We were talking about testing and how if you're tested today, you may tested negative today, you may test positive in 2 weeks. Or if you've had it, then we're tested positive, then tested negative. 2 weeks, you could be testing positive again.
Yeah, it reminds me years ago, my mother was in the hospital for an autoimmune condition. And when she was much younger, in her teens, back in Germany, she got tuberculosis. And the method of curing somebody with TB back then was to wrap up the patients in heavy blankets, put them outside on a lounge chair, and let the cold, icy air kill off the infection. So she went through this procedure, and the girl to her left died, the girl to her right died, but my mother survived. And when she went into the hospital, she tested positive for TB, even though she was not actively experiencing tuberculosis. So they put her into an isolation room with the reverse air flow. And that was a crazy time because they all thought she had TB.
Yeah, it's quite interesting. I also have a mother story. My mother and her two sisters had typhus during Second World War.
Yeah.
Second World War, and that was rampant during wartime. It was rampant in all over Europe. So unfortunately, her two sisters did pass away at a very early age. I think one was 13 and one was 14, and my mother was, I think she was about 16 or 17 at the time. So, touch wood, she's 98, and hopefully she, because of overcoming this epidemic at such an early age, I hope she's not only built a strong immune system, but passed it on to us, Yeah,
because as one of my friends, her father, despite having multiple health conditions, has always pronounced his motto, which is, I'm going to survive to 105.
How old? How old is he now?
I think he's in his 90s. So he's getting there.
Well, I had my father would have been 105 on the 4th of April. And, I come from a very large German family, and we had emails going back and forth, and a couple of my siblings were saying, yeah, he would have been 115 this year.
115.
Wow. Okay. 105, 115, I guess there's not really much difference, although you hear more people living to 105 than well, not today specifically because of this tragedy that's going on, but yeah.
Hey, somebody's out there. Is anybody out there? We can't, the funny thing is I put this into our group, which is Total Health Live. And because of StreamYard does some funny things, we actually cannot comment to the group. But I'm going to, while we're talking, I'm going to go over there and see who's watching. Can you identify yourself, people?
Well, I just also want to address that I've been trying to fix my camera, the way I look at the camera, and we've been working on different ways of doing this.
You want to look like this, or?
this way or that way. I'm looking at directly on the camera right now, directly at Christopher, and I look like he's. Anyway, we're going to get this fixed, so I don't look like I've got shifty eyes.
Yeah, just go this way and that way and this way. You're fine. Don't worry about it.
I hope I'm don't look
the message is more important than where your eyes are floating.
Marshall McLuhan, the message is the
medium.
The message
is the medium, or the medium is the message. I thought the message was the medium.
Whatever.
Medium rare. Actually, rare. I prefer rare or blue for my steak. So that's
I'm still wearing blue. I have so many blue things, and it's not a hoodie today. It's actually a lace
hoodie.
So I'm trying to be a little more.
You know what? This is the frustrating thing. So we may need to change this in the future, because I see that there are 2 of you watching right now, and the only problem is if I look to the group to see who you are and what you are doing, and if you're making any comments, the problem is that it will automatically start a watch party, and I will have our broadcast 20 seconds delayed of what we're currently doing. So my apologies for that. We will answer the comments in the comment section after we conclude today's presentation.
That is confusing.
It is confusing, but
I hope you have it handled.
I got a handle on it.
So I just wanted to give you, we've talked a couple of last week, I think we talked about kind of food that we're preparing.
What kind of food are you preparing?
Yeah. So I had one of my last outings in the world out there. I went to my local Sprouts and I bought some swordfish and I bought some ahi tuna. And so I pulled out the swordfish the other day and I made swordfish with lemon, garlic, like chopped up garlic and fresh lemon and rosemary, which we have in our right outside our door here. So there's so much rosemary. Usually you can find it everywhere. It grows pretty wild. And so I did that and some grilled asparagus and what else? Oh, and some potatoes, some red potatoes, and very nourishing, very satisfying. And the funny thing is, every time I have someone volunteer to go shopping, they usually find everything that's on my list, which is
pretty good, because we have not had that experience.
Yeah, that's what you were saying. And no matter where you go.
Well, no, my foray into the great wilds of Southern California was where I had my bandana on, the gloves, the whole thing, and that was very successful, because it was a wholesaler of produce, but they also had milk and a few eggs, a few other items that they brought in. So I got this giant box for $30, which is far less than we would have spent otherwise having shipped or Instacart or somebody else deliver or shop for us. And I was so impressed with them. I sent them little shout outs and everything. And I mean, in our digital agency, I was thinking I'm ready to just help them tweak their website, because they were so helpful, but their menus or the stuff that was available was from a week ago. But they're on the phone all the time answering people's questions. What do you have now? What do you have now? What do you have now? I think they just need a little help, because they supply all the restaurants. They supply other smaller grocery stores.
You mean help in
just managing what they're doing on their website? Because, and we've seen this too with restaurants who are doing takeout. We had a restaurant that opened about 3 weeks ago. Wrong time to open, but they immediately, and you saw all the tables, beautiful decor inside, but they immediately transferred their whole operation. They pivoted into takeout only and offered specials and everything else. But to call them and to get your order, sometimes you call for an hour and a half, and you couldn't get through the lines. And when you're standing in line at the restaurant trying to get a takeout order, you're listening to the phone continuing to ring, because they only had one telephone line. And so that's a situation where, for those of us who do digital marketing and internet marketing and know all this stuff, gosh, there are a lot of opportunities to help these people distribute food more efficiently.
There are a lot of opportunities. And, this is going to call for a lot of creative thinking. And I just think everything's so new, but people are really hopefully finding new ways of doing things, as you're saying, going to a wholesaler, seeing the opportunity of helping them, you know, man the booth, so to speak. And it's quite incredible.
And I will tell you, the wholesalers, I felt more comfortable going to the wholesaler warehouse than I did to a grocery store, because these guys, they took everything serious, all wearing masks, all keeping distance, all with gloves, and they would wipe down all the surfaces every hour.
Yeah, you were saying that last time.
I was like, you wipe down the surfaces every hour?
Yeah. That's really good. That's really good. And that's what we need to do. I've been, you know, of course, adamant about people here wearing gloves and masks, any kind of, you know,
protect
whatever masks. So, you know, most of us are wearing surgical masks here. So, but we're using them, unfortunately, until we, you know, can get them on an ongoing basis.
Well, I think you are in an extreme situation where you really have your whole house, the whole floor is basically a hospital ward.
Yeah, the whole downstairs. Yes,
it's a very different circumstance than most people whom we encounter.
Yeah, and maybe one of these times that we're together here, I'll go downstairs and show you just exactly how everything's set up.
I think people would like to see that. It's sort of like, you know, pay no attention to the man behind the curtain, but actually we want to see the woman behind the curtain. So
yeah, I mean, it's evolved certainly at every stage that my husband has lost less and less function.
Oh,
you can't stand.
Oh, good. Thank God. You froze for a second. You froze for a second, and I thought we were losing you. So.
Oh, okay.
You're back. You're there.
No,
you're there.
That's what happens a lot. Yeah.
Yeah.
So I'm
You've
here.
Got a lot of gamers. You've got a lot of gamers and streamers in your neighborhood. There's no doubt in my mind.
Don't know, but I keep losing internet connection, and you know, I did call Spectrum today, but I didn't get anything completed because whatever happened, it fixed it, but it keeps on happening.
Well, you just need to report that, because internet connection for you is quite vital, both for phone service for your husband and for you and everything else. So.
Well, I do have a cable, a regular landline. I just don't have a cable line. Yeah, I just needed to do that. So of course I have, you know, cell phone access as well. But yeah, I have one phone that's connected to my internet, but the other one is definitely a real one, the old fashioned kind.
It's not a fake. Do you have the rotary dial?
I do not.
I'll say that's me. Or you pick up, you've got your receiver.
Oh yes,
you've got your speaker and your receiver in two parts.
The beginning of the
that would be. I would call that. Yes, I would call that the old-fashioned kind. But most people have never seen one of those.
Yes, yes, yeah, and so back to food accessibility, and you know, people are thinking about, you know, growing more. Growing
takes time. If you want to have a meal tomorrow, I don't think there's enough time to plant the seed and let it germinate.
But we need to think future. We also need to think future. And, you know, it is springtime. It's planting season. And we've certainly had enough rain here in Southern California. But we're talking to everyone, not just in Southern California.
Well, no, I know that, because my sister was supposed to go inline skating for the first time ever this morning. And in Syracuse, it snowed.
Yeah.
So she's grateful for not having planted things and having them expire under a cover of white stuff.
Well, it is too early. I mean, I grew up in the snow just like you did. I grew up in Canada, in Winnipeg, which is, I remember 75 below zero on some days with wind. So I survived. I suppose that helped my immune system as well.
It could, yeah. If you it also that type of weather breeds extreme optimism, because you know that you can make it through the next winter.
And creativity too, because you're stuck, sort of like what we're experiencing right now. You're kind of stuck when there's a blizzard.
I'm just wondering if people from colder climates are maybe adapting a little bit better to being stuck indoors, you know.
Yeah. Well, I mean, here it's different because you know, we're outside all day, all year long, but I think people do get cabin fever no matter where you are.
Yeah.
What sort of climate you're in.
I mean, today was the big outing for the day. It was almost the outing for the week that we got to go outside, drive somewhere, and pick up masks. was
But
big.
you did go to the wholesaler this week, but this was a
Oh,
family.
I did go. Yeah, this was a family event because we had 3 people, 3 IDs were necessary to pick up those 3 masks.
Wow. So this is like, it's like the simple things.
Oh, yeah.
Things. I mean, this is like an outing, going to get masks, the 3 of you.
Going to get masks. It's a big recreational event.
It is, you know.
It's essential. It was not frivolous. It's not like let's go for a drive. It was like, let's go get masks.
You know, we've been talking for years and years in the popular media about gratitude. Well, this is the time that we are really.
We are totally grateful for someone who organized this so that everybody could have masks.
Yeah, definitely. And there's people stepping up. My sister said she was trying to make a mask. She brought out her sewing machine. She was trying to make it, and she had 2 attempts and it just didn't work. So hopefully she's going
I could put a link down below to several people with how-to videos.
Yeah.
We have in our digital agency, we have a person who's created a number of different tutorials for her customers on how to make masks.
They're all over the internet. They're all over YouTube, how to make them. And you don't even need to sew. You just like fold fabric over, put some rubber bands.
I did the one the other day with men's boxers over my head and covering. It worked perfectly, but I looked incredibly stupid. So I took it off.
But does it matter what you look like now? I mean,
no, it doesn't matter what you look like. But I went out with a bandana because I didn't have a mask, but the bandana was thick to begin with, and it was in 2 layers. So I actually felt more secure that I wasn't going to cough on anybody with 2 layers of thick cloth.
Yeah. Those are, you know, that is, I mean, they do have, you know, indicators of what works best. Of course, the N95 works the best, and then the surgical mask. Because, in fact, one of my aides, she said the best way to know if you've got like air coming through there, so you'd be more susceptible to doing the droplets or excreting the droplets or whatever we do. He put a Bic lighter in front, and if you can't blow it out, it's safe. It's a safer mask. So he is.
So this is one time when you want to flick that Bic.
Flick the Bic, or you know, just, you know, I mean, basically the N95, which most people can't get, the surgical mask, so it's like tiered like that, and the bandana less, of course, but it's better than nothing.
The bandana to me was better than wearing a banana.
Banana bandana.
Well, I think the bandana trumps the banana.
I bet there are banana bandanas.
You just put you just put the banana peels over your face. It's rather appealing, but I don't know it's very efficient. That's the problem.
It's rather difficult to breathe with having it on, but I'm sure it could be fun. Might slip.
As long as it doesn't slip on the floor. So. But so masks are a big thing. I remember seeing something recently too that they had taken. There's a fellow in Southern California, actually LA, up in your way, who is a fashion designer, and he had his workers actually create a number. This is like haute couture. You create the workers. They actually used material from furnace filters and created the masks with the furnace filter material inside of them. And they were found actually to be more efficient than the N95 mask, which I thought was very interesting because that filter material was great.
Have you seen the ones with coffee filters?
No, but are they caffeinated?
It's really, it doesn't matter.
It doesn't matter. Okay.
Espresso, caffeinated, decaf, whatever.
Just don't try to put those K cups over.
Like a duck, right? Because
don't put the K cups over your mouth because they're too small.
That would never work. Never ever. I mean,
if you pucker, you have one here and one here.
Well, I had a new person come in yesterday, and so I was wearing my mask for the most part, but sometimes I'm just going downstairs, so I'm like this, you know, or like this, or, you know, covering, you know, doing whatever I can so I'm not breathing on anyone. And certainly I saw some funny video of, I don't know if it was true, but it was in China where people would bump into each other in a hallway and just turn around quickly and face the walls and kind of like scale the walls past each other. It was very quite funny, but I mean,
it's probably true.
I think so. I mean, we have to do what we have to do to be safe and get through this.
Our perception will be forever changed by this whole major pandemic event.
Oh yeah. Oh yeah.
Now, so the question, I spotted the question on Twitter today, which was, and it was an interesting question. I was thinking about, will we ever get to the point where we're back to shaking hands again, or is handshaking gone in terms of social gatherings? Yeah.
I don't know. Well, it is now, but I don't know. I kind of like the handshake.
I like the handshake too, but handshake, you just put a little hand sanitizer on before you shake.
Why would the handshake go and the hug stay? Why would kissing
question. Stay? Good. No more kissing. No more kissing. No more hugging. No more handshaking. That's not
going to work. That's not
I know that's true. It's totally true. Yeah. I think the handshake is less of a problem than a kiss on the cheek. So.
Yeah, because it's closer to our vulnerable areas.
But think about dating in the age of a coronavirus pandemic. Can you imagine?
I saw someone post something about dating now, and I'm like, no, it's not the best.
Don't do it. Do not do it.
Think about it.
No. FaceTime instead of pucker time.
Well, I guess it would work because you could develop a long distance relationship. You know, a lot of people do.
Yeah. But then, remember, with everybody's doing the HIV test. Before we do something more, I want to make sure that your test is negative. I mean, it's like you're going to be testing people left and right before you ever go out on the first dinner date.
Yeah. So now you have another level of
one more layer of uncertainty.
Another hoop, another whatever I'm trying to say.
I don't know if I want to jump through that hoop. Red tape. Another dread tape. It's
probably a good idea. My sister and my brother-in-law fell in love through letter writing. And this is in 1983, 4.
Was there was there a lip print on any of those letters?
I might probably.
You need to. Inquiring minds want to know.
Anyway, he was in France and she was in Canada, and so maybe we might go back to this kind of courting scenario.
I think it's more likely courting by video than it is by letter.
Yes, well, it is, 30 years later, 40 years later. So,
hey, speaking of your relatives, how is your brother doing?
Well, again, last time I saw him or spoke to him was a couple of days ago, and he was. We did a FaceTime. I was planning to call him probably or FaceTime him probably today or tomorrow, so I'll get an update. But I hope he's just on the mend and getting better and better. I mean, he seemed like he was in that state the other day, so I want to pray for him, and hopefully everyone can pray for everybody who's suffering.
Just say, "Talk to me, bro. Talk to me."
Yeah.
I remember he was getting speech therapy and everything like that, that's amazing to me because people who've had strokes, when they get immediate therapy, they do incredibly well as opposed to somebody who has nothing done with them or for them in those beginning stages.
That's part of the protocol in a hospital. When someone suffers from a stroke, especially this kind of stroke, they get into speech therapy and physical therapy right away.
Yeah.
My husband had the exact same. Well, it affected his 2011, and I tell everyone the thing that really helped him. We adopted 2 cats. Like, he had this in June. We adopted these 2 cats in November. We had lost our other cat the year before. We adopted these 2 cats. They were our Thanksgiving gift, and they helped him speak because he was talking to them all the time, and he wasn't getting any
he wasn't getting any negative feedback from them.
Negative feedback or nagging from me. So they were just like, it really, really helped. They were very therapeutic. Yeah. It was just really quite amazing.
Animals can be very therapeutic, except in my case where I'm incredibly allergic to cats. I don't know that I would. They might do me in as opposed to do me good.
Well, they won't do you well or do you good. So yes, well, that's too bad because I have a little one here. She's like such a comfort.
Is this Mitzi or Bitsy?
see the black and white. Yes.
Itsy bitsy cottontail.
Now I can't wake her up. You know, they all
well don't.
They sleep when you're not sleeping, and then when you're sleeping, they don't sleep.
they know when you are sleeping. They know when you're awake. They know if you've been bad or good.
They are Santa or Senorita Claus.
Plenty of claws.
Although I give my cat pedicures.
Catacures?
Pedicures.
Oh, I thought you did catacures in the catacombs.
No, pedicures. Pet for pets. Pedicures.
Cures. Yeah. Well.
She never likes them, but anyway. So whatever you can do to make yourself feel better in the next few days.
Because the mental health component cannot be underestimated. In fact, the suicide prevention hotline in the U.S., it's an 800 number, and it's been ringing like crazy in the last couple of weeks. But also there is an anxiety prevention, or I would say listening line, which is another toll-free number that people can call into if they're experiencing a lot of anxiety. And I will find those numbers and post them down below here, because even if you're worried or you have a certain amount of fear, or a lot of folks just watch way too much news, or the uncertainty, the fear of the unknown is really big always, but especially so in this heightened state of awareness. I will post those numbers because it's just a line where you can talk to people, and I think that's really important to be able to communicate with people.
And I really don't know anyone who isn't feeling some level of anxiety. How can you not? How can you not?
And now this is one case where, fear is protective and very good. Out of control fear can disable you from adapting and doing constructive things. Yeah.
And a lot of people are, may be susceptible, like, to a high degree. So of course you have to take precaution. But you know what really comforts you? Well, actually causes there's a lot of things, but I was just thinking about that today. I was watching Governor Cuomo, and when I listen to him, it's like calming. He gives you the facts. It makes you feel calmer. It makes you feel like a sense of community for sure. Right. And it makes you feel like you know what's going on, as much as.
I think the more factual your information can be, or your source of information is, I think the better it is, because it's better to have a realistic perspective than a Pollyanna perspective. Yeah. It's also better,
or a doom and gloom one. That the other option.
Better to have realistic than the doom and gloom perspective. Like, this is Armageddon. I see 4 horsemen, on the horizon right now.
Yeah, either one. Yeah, factual, grounded, explains things, is comprehensive, compassionate, and just building the sense of community is. And
and it's a sense of community. It's also the sense that and this more than anybody else, that self-care is extremely important. Put your oxygen mask on first before you take care of somebody else.
And I saw this video that, New York just did with the. What is the name of the band that sings this, Save a Life? That has been my new song in the last few days. It was sort of almost like a theme song for Grey's Anatomy.
Our song is actually Caribbean Queen.
Oh, by who?
Billy Ocean. It's got a great beat.
The lyrics of that one.
It's very uplifting. Well, if you listen too closely to the lyrics, it's a real good pickup song. But we just love, because my stepson plays the saxophone, and so he's trying to learn that sax solo, and it's very uplifting. And my sister Michelle actually loves this song. It's probably one of her favorites. So
this "How to Save a Life," back to that. I don't know the lyrics, and I'm not sure, but most people know it. But it's a campaign that they're doing. Yeah. And it's essentially what it is that you have the ability to save somebody's life. So you can save somebody's life.
You have the ability and the knowledge to save your own life, and in doing so, you're also going to save the life of those around you. This whole thing about community spread. If you do the responsible thing and stay at home, then you're not going to pass it on to 2.5 people, who pass it on to 5, who pass it on to 20, who pass it on to a couple thousand people.
Yeah, and it's a simple thing. Just stay at home. You can save a life just by staying at home.
Stay at home. Surf the web.
Just by wearing a mask. Just by wearing gloves.
Binge on Netflix. Binge on Netflix, and you'll save a life.
Binge on whatever. Yeah, there's. I mean, it is simple, but it's so profound. So profound.
Simple,
I mean, something
and profound.
Like, simple and profound. So, with that,
I think let's stay simple and profound, and leave on that note that stay at home, take good care of yourself, eat as healthy a diet as you possibly can. I would prefer, if you can't get fresh vegetables, get frozen. If you can't get frozen, get canned. But for God's sakes, don't abandon eating plant-based foods. You don't have to be a vegan or vegetarian or anything like that, but be sure to get plenty of veggies into your diet, despite the fact that you may be stuck at home. And then plant for the future, as Monika says. Plant for the future in some ways. Yeah, hey, we've got artichokes that we're harvesting now. They were planted some time ago. So yeah, pretty cool. I
really do miss living in Malibu because we had this big organic garden and so much. So we had artichokes for sure. We had pomegranates. We had all sorts of wonderfully fresh. You can just pick them off the vine or the earth. Pick them out of the earth.
We have people here in Coronado who will put a little notice on our Coronado happenings, and they'll say, "Hey, I've got lemons. If anybody wants them, stop by." And they'll have a box of lemons from their lemon tree, oranges.
I think we have a lemon tree outside here.
We refer to it as living off the land. You just wait till you find a notice or you see something, and people are giving things away, which is very nice to see.
Living and giving.
Living and giving.
Living and giving.
And with that, with living and giving, we'll be back Wednesday of next week. I promise to be on time because I ran late with a previous broadcast for internet marketers on email. And then Facebook, if you're not in there by 10 minutes, Facebook deletes it completely. So I learned that lesson the hard way today.
Glad we learned it.
Live and learn.
Live and learn. Stay healthy.
Stay healthy. If you have any questions, stick them in the comment section. We will do our best to answer them within the next 24 hours. And we'll see you next week.
See you next week. Bye.
I need to find that end button. Not because the end is near, but because I move my screen around a little bit. And we are ending now. See you next week. Stay alive.
Bye.
Stay well. Bye-bye.